So welcome back, everyone. Hopefully everyone got online and got connected, got all the technicalities to work. We're truly excited about doing this webinar today. We have a record number of people joining our webinar today. As always, you can use the chat on your right to ask questions during this webinar, and please also do help each other. It's always nice to see how much knowledge is gathered in these webinars. So help each other and ask some questions along the way. The topic for today's webinar is 21 CFR Part 11, and our take on it today is really to bring up some examples and some experiences based on compliant temperature monitoring and mapping. So within the space of temperature monitoring and mapping, how does 21 CFR Part 11 apply? But also in general, what are we talking about when we say 21 CFR Part 11? It's a topic that we get a lot of questions on whenever we have webinars or during our daily work with our customers. So hopefully we can share some of our insights. This is based on our experience. We have several hundred customers and we always get feedback on how these different regulations apply in the different areas of the GxP. But who are we? Why are we here to talk today? Together with me, I've got Anders, and those of you who've been on the webinar before knows him. He's really good at asking great questions, and he also helped bring up some of your questions along the way. You're always welcome to use the chat on the right side of your screen to ask any questions, but if you'd like to ask privately some questions, you can also use the questions functionality in there. We won't name out or call out your name during this webinar, so we'll just bring up the question as it goes. My name is Jakob Konradsen, and I'm the head of quality here at Eupry and also one of the co-founders. So I've been with this company for the last 13 years. My areas of responsibility are quality, of course, as we see it, calibration, validation, making sure that we service the products to our customers that they need and help them stay compliant with the different regulations in the industries that we serve. So first of all, just a tiny bit about Eupry. Why does it make sense that we talk about 21 CFR Part 11? We were founded back in 2014. We service more than 50 countries and more than 6,000 locations, and we do a lot, I would just say, of measurements every single year. We supply the GxP industries with thermal compliance services and products, so we do everything from mapping to monitoring to continuous mapping and monitoring, calibration, in order to make sure that our customers can live up to the requirements from regulatory bodies. Our mission always has been and still is to supply a one-stop solution for guaranteed compliance. So what does that mean? That means that we will take care of everything surrounding your thermal compliance needs, everything from validation, monitoring, continuous monitoring, calibration, mapping, and our latest product service, which is continuous temperature mapping and monitoring. I would highly advise, if you find that interesting, go watch our webinars online. All of them are for free, easily accessible. You can go and watch a plethora of knowledge and information in there.
It's on eupry.com/webinars.
Yes, yeah, exactly. And we'll put it in the chat here as well. Some of the people behind the screen will put it in there.
Maybe even to say for today's agenda, what you're also seeing here is then that when we talk digital audit trail, that's actually what we leave behind on all of these, as we inherently also are.
Yes, exactly. So we try to help with everything related to thermal compliance and all the different validation needs and monitoring needs surrounding that. So therefore, it's of course also interesting to look at 21 CFR Part 11 compliance. And the agenda for today is basically that we're going to go through what is 21 CFR Part 11. We're not going to dwell too much on what exactly the regulations are, but more go into the topic of how that correlates to thermal compliance and what it is the FDA and other regulatory bodies are looking for in relation to 21 CFR Part 11 and thermal compliance. We'll look at digital records, we'll look at requirements, a bit of tips and tricks, some of the feedback we get from the field, what are some of the topics the regulators and auditors are looking for. And hopefully we'll also get into other topics if you have great questions along the way. But I think without much further ado, I think we should just get started. So first of all,
just ask to say if there's something you hope we will cover during the session, maybe just put that in the comments now. Jakob, obviously you've outlined an agenda for us already, but then I can have a little bit of a peek on those comments and see if I can steer them into the conversation. And as always, try to ask the stupid questions if they're not asked. Yeah, go ahead, sorry.
Absolutely, thank you very much. So First of all, I think it's very important to be on the same page in terms of what is actually 21 CFR Part 11. And you could answer it rather quickly as the 21st chapter of the Code of Federal Regulation, Part 11. But that doesn't give us much context. Yeah, if you want to go look it up online, it's a fairly small set of requirements, and they're fairly easily readable. But some of the reasons behind these regulations is basically that we want to be able to trust digital records in the same way as we do with the written records. In other words, from a historical standpoint, these were introduced in 1997 with an enforcement guidance updated in 2003. And the basics of it is that we want to be able to trust digital records. We want to trust records that are used to make GMP decisions, as we'll also go into a bit later on. But really think about it as a baseline for being able to operate a digital production or digital development in order to still satisfy the requirements of the FDA. And I think as a side note also, we're seeing that a lot of European countries are starting to adapt it, even though they might not have sales directly to the US, because it's really a good basis for ensuring that the different records and digital systems can be trusted in the same way.
I actually loop in the first question from Chris Martin exactly to that point, saying, I'm curious as to why we always talk about the 21 CFR Part 11, which is the regulatory requirements in the US, hence, of course, the FDA. So why do we not speak about the EU GMP Annex 11 when this is the European equivalent?
I think it's a really valid question. You always have great questions, Chris, so thank you for that. What we are seeing is that the Annex 11, the EU GMP Annex 11 is quite well understood often, and often the question goes toward 21 CFR Part 11. I would say from our experience as well, when you satisfy 21 CFR Part 11, you tend to also satisfy Annex 11. Yeah. And yes, you could talk about both, and maybe that's a great topic for an upcoming seminar, but often we see that the questions are surrounding 21 CFR Part 11. That's why it's interesting. But yes, EU GMP Annex 11 is of course applicable to all European pharma companies and those who do cross sales and whatever. But there are also a ton of other guidelines we could go into. But thank you very much, Chris. Before going into why all of these and how to apply these different things, I think it's really important to get on the same page in terms of truly understanding 21 CFR Part 11 compliance. And that's really to think about people, process, and systems. There is a large discrepancy between, in my opinion, at least between what the objectives of the regulations, the guidelines are, and how it's actually being applied in different organizations. So just to get on the same page in terms of how we view it, how we see it at least, and I think a lot of people share my opinion, is that systems enable compliance. So systems are not compliant in themselves, especially when we're talking 21 CFR Part 11s, but they do enable us to act in a compliant way. Secondly, processes, those support and ensure compliant use. So using systems through a set of processes that are agreed upon and that are repeatable support a compliant use. But in the end, it's people who have compliant usage. I think the easiest way to exemplify this is that even though you have a system that is set up to force you or to support you going through creating records in a certain way, you could always share your password, or you could always not follow the process depending on how stringent the enforcement is. But it's really important to remember that it's the people who have a compliant usage of these systems, and it's the processes and supported by systems that can make you compliant 21 CFR Part 11 compliance. What we're seeing a lot of is that organizations buy systems or use systems which have a statement about being 21 CFR Part 11 compliant, but if you're not using it compliantly, then it kind of doesn't matter in either sense. I hope this makes sense behind the screen. Otherwise, let us know in the chat. So one of the first things to get straight is what are digital records? And for the records you have, is 21 CFR Part 11 even relevant? So I have a lot of blank sheets. Yes, they are. And if they are, yes, they are relevant for your records if the records are mandated by predicate rule or the records are submitted to the FDA under predicate rule. So there is a guidance definition of which records are mandated to be applicable to the 21 CFR Part 11. But if we put this in simpler terms, or the question you could ask yourself is digital records that replace existing paper records with handwritten signatures. So first of all, what is a predicate rule? The predicate rules are the underlying FDA regulations that requires you to keep records in the first place. So in other words, if the FDA requires you to keep certain records, then those records, if you keep them in a digital system, well, then the 21 CFR Part 11 requirements apply. Or in very simple terms, if you have any records that you rely on in terms of making a GxP decision, well, then those records replace existing paper records with handwritten signatures, well, then 21 CFR Part 11 is applicable to you. So an example could be that your GDP regulation requires temperature records during storage and use a digital monitoring system instead of paper chart recorders. I don't think there's much of those left in the industry, but they do exist. Those digital records fall under Part 11 because you rely on those records in order to say anything about the efficacy of the product. You use those records in order to justify that you have traceability, they have a cold chain traceability across your supply chain. So what are electronic records? So the FDA has a definition of this, that basically any combination of text, graphics, data, audio, pictorial, or other information in digital form that is created, modified, maintained, archived, retrieved, or distributed by a computer system. So that's a very complicated way in my mind of saying everything that's on your computer, right? It's really, really hard to find any records that satisfy the definition of a record on your computer that are not really applicable to the 21 CFR Part 11. I hope this makes sense. So I have just lost my mouse here. Yes, sorry. So the scope of the 21 CFR Part 11, basically it covers electronic records. So that's what we've just discussed. It covers electronic signatures. So basically anything that you would otherwise sign in a paper record, or any records in a digital system in which you apply any sort of logical controls or you change the state of anything, those should be supplied with electronic signatures and handwritten signatures that are executed to electronic records.
Now that we both mention handwritten and electronic here, let's say we have both for the same document. Which one is actually the valid one?
So in our experience, the FDA treats the digital system as a digital system. And even though you choose to print out some of your digital records and sign them by hand, they do not exclude you from having to apply 21 CFR Part 11 to your digital records. So what we've seen sometimes is that companies will try to exempt themselves from 21 CFR Part 11. I'll say that word a few times this webinar. By printing out the records. But in reality, those digital records, if they are generated in a digital system, then 21 CFR Part 11 still applies. You can't hand pick the records that you would like to sign by hand and thereby avoiding to apply 21 CFR Part 11.
Yeah, so in short, digital goes before physical, if that exists?
Yeah. Yeah, I mean, think about it this way. Like if you have a computer system, like an environmental monitoring system, and that monitoring system produces a set of temperatures or other information that's relevant to the storage of products, well, those records are generated by an electronic system, and you would still need to apply them. I would say also in relation to sometimes we see companies trying to sort of not circumnavigate, but exempt themselves from the regulation. Once you understand 21 CFR Part 11, it's actually not that cumbersome. It's actually not that complicated. And with a little bit of work, it's actually quite easy to understand why they're there. As we'll go through in this webinar, there are certain requirements regarding the use of digital signatures, but the rest of it is basically follows what I think Annex 11 explains in greater detail, that you need to have your systems validated, you need to be able to trust your records, and you need to be able to retrieve them and so forth. So it's nothing out of the ordinary. I think there's a large misconception that 21 CFR Part 11 is a very complex set of guidelines. But I would say it's not. A lot of it is very, very logical. And a lot of it, you would still have to validate systems and so forth.
Of course. Yeah. Let me just continue that a little bit because Paula Elena is asking, is it possible to do a combination of wet signatures and electronic signatures in the same document?
It is possible, yes, but of course there are a great question, by the way. What we see out there is that the reason behind, or the rationale behind combining wet ink signatures and digital records is often that you want to try and exempt yourself from assessing the system as per 21 CFR Part 11. And that often does not satisfy the auditors, because you still need to be able to, even though you wet ink signature something, you still need to be able to trust the digital record in the first place. Like if your system outputted some totally wrong values, now if we're talking thermal compliance, totally wrong measurement data that you wouldn't be able to trust, a handwritten signature does not solve that issue.
No, of course not.
You still need to be able to trust it. And if we say we'll validate a software system, a digital system, and then we just want to exempt ourselves from validating the digital signatures, there's not so much to gain. It is a combination that we've seen use from ever. Okay.
I think a little bit on the timeline, both being asked by Dashana, how long should it be preserved, but also from Taha saying, is 5 years retention policy good enough for Eupry's temperature and humidity records for the monitoring locations? Can you say a little bit about timeline for these?
So retention policy actually does not have so much with 21 CFR Part 11 in itself. It does have requirements for being able to have retention on your documents, but the requirements for storage are based on whatever application it's in. So there's a user of our system I can see here. We export monitoring data from Eupry on a weekly basis and save them on our servers, which are backed up every night. Should we still print them and sign them on the hard copy? Another great question. So one thing has to do with data integrity, and the other has to do with why are you signing? So if you have a process that either a self-made internal process or a process in relation to the specific area you're working in, where you need to review and sign, as an example, well, you can either apply that signature on hard copy or you can apply that in digital, but it really has to do with why you're making that signature. So that does not exempt you from ensuring that the system produces valid records. I think some of these things will I'll just put a small stop under. Great questions already, but some of it we'll go through in a short while.
Great, Jakob, thanks.
But first of all, I think it's really important to understand that these requirements are both for the actual data and the signatures that accompany it. Yeah. Just a bit about some of their guidance and the scoping of the application. So in 2003, the FDA basically issued guidance where they clarified more of your risk-based approach to how to apply Part 11. And some of the priorities from the FDA were basically having audit trails. So in digital systems, unlike more traditional paper-based records, your changes can be all over the place, and it can be really hard to understand where were changes made and by who. So some of the approaches are on the audit trails. Can you go back and see which changes were made by who and when and for what reason? And that some of the items will go in. They have focus on record retention. So back to the question relating the retention period, basically how do you ensure that you can keep accessing this information if you have to store it for, let's say, 10 years. So a great example of this is, well, everyone knows a PDF today. A PDF might live, the file format PDF might live in 10 years, but does it live in 20 years? We don't know. So it's really important to have in your life cycle assessments of your computer systems, what kind of records do they produce in which format, and how do you plan to retrieve them? Another great example we have is some people tend to not print them, but write the information on CDs. Well, most CDs only last around 8 years, depending on the quality and so forth. But it's really about thinking, how do I get to this data at the end of my retention period? And it also has priorities on ability to produce accurate and complete copies of records. So basically, think about it in another way. Think about when you have data and information. You have sort of the raw data, but it might be accompanied by contextual data that shows you, well, the greatest example, a good example of that is if you have a lot of temperature measurements, but you don't know where they came from. First of all, they should be accurate. It should be in the same representation as they were captured, but also they should be complete. If you just have a long list of temperature measurements, but you don't know where they were taken or by which sensor, it's really, really hard to produce that that concept of why that information was important and where it does apply to. So first of all, Part 11 compliance is not all or nothing. It's really about using a risk-based approach in which areas of your, I'm guessing, vast amount of software systems does this apply, and to which functionalities. First of all, predicate rule requirements. Is this some type of data that we're relying on in order to make a GxP decision? And then layer on Part 11 controls appropriate to the risk. So we both see companies that do very little in terms of Part 11 compliance, but we also see companies that apply way too much rigor in order to ensure that all their records are compliant in places where it's really not required. Yes. So moving a bit on in terms of what are the requirements then, and remember we're looking through this as a scope of looking at 21 CFR Part 11, but also looking through thermal compliance. So first of all, it's important to understand what are some of the sub-requirements of Part 11. The sub-part A handles general provisions, so basically the scope, the applicability, and the definition, some of what we just went through. Sub-part B handles electronic records, so basically what are some of the requirements and controls, signature manifestations, for example. It also has to do with these linking signatures to records and the validation of the systems we're working with. And subpart C specifically handles these electronic signatures. It both has some general requirements and also some signing requirements. What are the different requirements for passwords? And also a bit about this legally binding that we'll get into in just a short while. So first of all, in terms of system validation, most people working in this field are used to validating systems, and it actually also is a Part 11 requirement. So back to my point at the beginning, it's not a lot of extra effort often to assess a system in terms of its Part 11 compliance if you already have a system validation in place. Yeah. So Part 11 does require systems to be validated, and the validation basically means having a documented evidence that a system consistently does what it's supposed to, in very basic terms at least. And one of the frameworks that can be used for this is the GAM5 framework. That's what we use in Eupry to validate our own systems. Basically use a risk-based approach to computer system validation. And the risk-based approach when dealing with 21 CFR Part 11 also is in line with the FDA's expectations for how to apply 21 CFR Part 11. So if we're looking through the scope of 21 CFR Part 11, when doing systems validations, think about what is important in terms of having a reliable and trustworthy digital systems for your records. So you want to be focusing on traceability. Do we ensure that the records that are made on the systems are accurate and liable and traceable? And can we trust that when we sign off on a record that the linkage between your signature and the digital record stays true throughout the system? Or does it change context over time? It can actually be a bit of an issue because digital systems are very user-friendly. You might show some information in some view and some other in another.
I know one of the frequent questions on Teams calls and in meeting rooms would be the correlation between risk-based and then, do you have to sign every single document, or how does that go? Maybe.
Yeah, so there are sometimes a bit of confusion regarding, like, can you sign several different records with the same? And in our experience, I mean, the Part 11 does allow for that, but the most important, I often go back to sort of how a paper record signed. Yeah. So if you were to sign a contract for your house, for example, you would want to have the whole contract there before you signed it. You are aware of what you're signing because you're doing like a physical act. And in the same way, the essence in 21 CFR Part 11 is also that whenever you're signing something, you're aware of what you're signing. What are the changes you're signing? In some systems, if we're talking very broadly, it can be sort of a little bit a gray zone. What are you actually signing right now? And what is the reason you're signing? Back to why are you signing a printout of temperature data? What is the reason behind it? And the same, are you approving something? Are you just signing to put it in as a draft? Are you making a conclusion based on the data and so forth?
Thanks.
So again, categorize software by complexity and risk. The amount of risk that is involved in this specific system. Are there fallback scenarios in which the data is being stored somewhere else, whatever it might be? And then appropriate level of testing and documentation. I would say that there's a lot of work being done also moving towards CSA in terms of being able to do risk-based testing. What are the core functionalities of a system like this? What is the most important thing? And I think we have a question here that came in. Especially considering the upcoming Annex 11 draft, which has significant changes. Yes, so totally agree that the Annex 11 is very interesting at the moment, also with the changes that are applying. Again, I think we'll talk about the 21 CFR Part 11 this time. So David has a question as well. Often companies use off-the-shelf validated system and they have no control on the supplier making changes which could impact validation without notifying the user. What are your thoughts on overcoming the problem? So thank you very much, David. You always have some great questions as well. So I think it's important to separate what are some of the validation and control needs and what are 21 CFR Part 11 needs. And they share the common requirement to keep systems under control and keep them in a validated state. So yes, there are, when I would say around 10 years ago, 15 years ago, when we started to moving from on-site systems to cloud systems, there was this idea that you would lose control of the validated state of your systems. And in some cases that's true, in other cases not. It's really, really important that vendor qualification and vendor vetting is a large part of having a system that's compliant if you're using something that's being managed by a vendor. Often what we see is that in order to satisfy the validated state of a system, you would need to do what we call delta validation. So basically, whenever a new version of the software is coming out, you do a gap analysis between the new functionalities and the existing and what has changed. You would often do some type of simplified requalification if we're talking less critical systems, and you would validate the new functionalities if you tend to use them. And that actually goes back to appropriate level of testing and documentation. What we're seeing in by and large is that companies are becoming really, really good at using a risk-based approach, looking at the functionalities that are truly critical to the application and the ones that involve a large amount of risk.
And I guess the release notes from the given suppliers will be a pretty good indication for where to look in that risk-based analysis on the delta validation, right?
Absolutely. So that brings me, sorry for the point here. So for temperature monitoring, specifically ask, do you produce accurate record temperatures? And I don't mean accurately in the terms of we're measuring the temperature or humidity or differential pressure, whatever it is, accurately, but do we capture throughout the system? Do the records, are they accurately transferred through systems and applied to different various export functionalities? Do alarms trigger at the correct thresholds, not only in terms of like sort of an IQ, OQ, PQ way, but also is the accuracy of the data maintained throughout the systems? And are audit trails functioning and tamper-proof? Basically, can we trust this system? Back to the signing on a house, you wouldn't want the lawyer to change the contract after you sign it, right? It really goes back to that. Preferably not. And also, can records be retrieved accurately after archival? I think that's a very important thing, and we're seeing a few examples here and there on not necessarily not being able to retrieve it, but not being able to show that you've taken that risk into account. Now, we had the great question earlier that I could hear a customer of ours would export the monitoring data once a week and sign them by hand and keep them on record. For paper records, specifically like how long time does the paper last and so forth. But if you're storing it digitally, how do you ensure that you can open that file format in 5, 10, 15, 20 years, however long your retention is?
Can I just squeeze a short question in from Derek Freeman? What is the difference between electronic and digital signatures?
Yes, so digitals, it basically has to do with the cryptographic nature of it. So think of it as, I often avoid talking too much about it, but basically digital signatures has a element of cryptography, which basically is traceability in it. So basically, can you, using modern techniques, ensure that it was you who signed that specific record and that the record was not tampered? I think I'll leave it at that. Cryptography is not my specialty. There's so many great questions, but I'll just try to move on in terms of time. So some of the key requirements to address when making an assessment of a system for 21 CFR Part 11 are data integrity, user access. So basically, we ensure that the integrity of the data is maintained, that it's untampered, that throughout the systems we don't show different representation, so forth. User access control and authentication. Basically, how do you make sure that you have the right users with the right permission levels in the system, and how are those authenticated? Audit trails. Which actions in a system trigger an audit trail? You need to document your process. Basically, how is it you apply the process and the human to this software system? It cannot do it by itself.
That was the people, process, not platform. What was the
people, process, and systems?
Systems, not the 3 P's. Yeah, we have
you need to have a change control process. So back to the question regarding what you do if there's a vendor who pushes a new version of the system. You need to do regular reviews, not only in terms of the users are in there, but also do the functionality change. Hopefully, you should have seen that upfront, or the supplier should have informed you. You should review your use of the system. How do you use it? Do the logical flows in the system still make sense, and do they still follow standard operating procedures? And you need to train your people. So going into some of these, first of all, data integrity. You need to protect against unauthorized access, data loss, and tampering. Basically, you need to have, or the system, or you need to have enabled the system to do protection. So you don't want people to have access to the system if they are critical assets, and you don't want to lose any data, and you don't want anything to be tampered. So basically, it's the CIA triangle, right? Confidentiality, integrity, and accessibility. You can apply the same checks. You also want to have device checks to ensure the validity of data sources. How do you, if you have for thermal compliance, if you have sensors, how do you ensure that it's the right sensors who send the right data and goes to the right places in the system? You also want to have your records linked to a person, time, and meaning. So basically, if you sign anything, how do you link those records to a person, an actual human being, at what time and why did they sign specific? So an example of that could be that a data logger records an excursion of 9.2 in a 2-to-8 room. The record must be tamper-proof. So basically, if anyone could edit that data to show something that was not critical, the data integrity is lost, and you require the system to prevent authorized changes. You don't want a system to be able to, you don't want users in a system to be able to change those values. So secondly, user access controls and authentication. So you want to have appropriate access levels, and this comes back to using the system. Most systems will allow you to make everyone admins, right? It can still be a 21 CFR Part 11 compliant system, but if you use it in a way where you don't apply appropriate access levels to the users in the system, basically you failed your obligation. And secondly, you want unique users. The common thing is, oh, we'll just have a shared login. It's easier on the shop floor to go and make some records. But basically, remember, if it's just a shared user, how can you prove who made that record? You also need to ensure that your employees or your colleagues understand the legality of digital signatures. Basically, a handwritten signature is the same as a digital signature, and that makes a whole lot of sense. Like, and also almost anthropological sense that whenever we sign something by hand, there's sort of a cultural understanding that this is, I did this and I put my word behind it. The same goes for a digital signature, and it's actually your obligation to ensure that everyone understands that a digital signature is as legally binding as a handwritten one. Yes, sorry. So you also want to have user authentication mechanism. So you want to make sure that, and basically we're so getting used to username and password, but that's basically all there is. 21 CFR Part 11 also allows for biometric scanning, like iris scanning or fingerprint scanning. It's not something we see a lot, but basically everyone should have the possibility to log in with username, email, whatever, and a password that's unique to them. So one of the first things to try out in a system is basically, can you create 2 users with the same username?
Yes.
That's a very obvious. So as stated, the signatures should be trustworthy, reliable, and equivalent to handwritten signatures. If you want to short it down like that, that's the easiest way to say it. And also what we see in a lot of cases not really being followed is that you need to identify your users. You need to identify somehow, have a process in place to ensure that there is an actual human being behind a user, and that you've verified that those are your employees, and that the linkage between the real person and the user has been made. We often don't see this when you have systems that are applied locally, but if you have global applications of systems like this, sometimes it may be hard to get that verification in place, and you might have local people to enforce that you have a verification that a single user and a single username is being applied to an actual human being. Anders will follow up with the questions along the way, but I can see the chat is lighting up here. So third is the audit.
We have some good and difficult for you to make sure you get one for later.
So audit trails, first of all, they need to be traceable. There needs to be a linkage between what was the action. Was it an approval? Was it a change of a certain record? It might be a change of a setting or something like that. Who performed the user? One of the pitfalls we see sometimes is that just the name is printed, but if the name of the person who performed it is not something that's unique to them, then you need to have a linkage to that specific user, and that username, of course, can only be for one user. And also, at what time was the action done? The easiest thing is just to print the date and the time down to seconds, then no one is in doubt. And that's also a bit of, I think, up for interpretation, but please correct me in the chat. But often what we will see is actually that auditors are not happy just having the date on there. So 19th of March 2016 is not accurate enough. You need the time and the date in there. And also have that linkage to which record it was linked to. It's really, really important to have that linkage between, because as an example, we sometimes see, for example, PDFs being signed in 21 CFR Part 11 compliance, and then it's very, very clear that that signature was on that specific record. But in digital systems, you can have a separation between the record and the signature. So it's really important to have an understanding that those two records must be linked through the entire retention of that document. And of course, record changes shall not obscure previously recorded information. If you've ever been out in the field and made corrections to something by hand, you strike through it without obscuring the underlying information, and the same thing still applies to digital records. You still need to be able to go back and see what was the previous value or configuration or whatever it was.
To this from Barama, what should be the appropriate frequency, so like intervals for verifying data integrity control, such as access control, audit trails, and related system safeguards? Should these elements be tested and demonstrated only once, or are they expected to be periodically re-verified? Incredibly sharp. Thanks. Yeah.
So I would say that all of these have a separate timeline. So something like user access levels is something that you need to verify rather often. Sometimes we'll often do it every 3 months to verify that access to systems, because you have people leaving and being hired and so forth. So that is something that changes a lot. Whilst like general safeguards to systems is not something that often will change over time. So that has a higher frequency. So it's really hard to pinpoint the exact frequency, but I would say take a risk-based approach, like how often do we change password policies, for example, or how often do we update our security infrastructure? It should sort of follow those same guidelines. I hope that sort of answered the question.
Yeah.
As an example for the audit trail, a warehouse manager acknowledges a temperature alarm, right? So who was it? It was this person. What they acknowledged an alarm, and which specific record was it? When did they do it? And which sensor was it related to? Now I can see I didn't put the date in there. So you caught me on my first deviation here, but basically, it's really important that we keep the original record. And then again, if we add a comment or whatever later on, we can see that history unfolding. We can see how the record evolved over time and what was added and subtracted and so forth. So fourth, it's really, really important to document your process. So again, systems in themselves are not compliant, as we started out saying. They can only be operated compliant. We often compare it with a car. Like the car is designed to be safe to drive, but if you don't put on your seatbelt, all of it really doesn't matter. As well, remember, like no matter the system, people make mistakes if they don't know what to do. I think that's the core of quality management. Yeah, we'll skip through this in the sake of time. And then back to the question regarding validation. Change control process should be in place. So we want to manage these changes to electronic systems. And this is not only isolated to 21 CFR Part 11, but we need to be able to manage those changes, assessing the impact of them. And the procedures basically should include like an identification. What are the systems we're talking about? Which versioning do they have? Who is the system owner and so forth? We should document, not only keep documentation about the systems, but also the evaluation, the approval, the testing, and the implementation. And back to the question that was just before, the monitoring. How do we plan to monitor the system? At what frequencies? What is our expected? And also one of the key things we often see as a failure is actually that you don't have a specific linkage to what happens if the system is being updated, what happens if functions are changed or updated. You should do regular reviews, as we just discussed. I think the question really encapsulated this, but basically you should monitor your procedures. Do they follow in line with how the system evolves? You should frequently review your monitoring system, specifically we're talking thermal compliance. You should monitor users in the system. Is it still the right users that have the right access levels, both in terms of being able to do their job efficiently, but also do we have we granted too much access, basically broadening our attack surface. So a small tip is schedule these periodic access reviews. We get a lot of feedback from our customers who were so gifted that people are willing to share with us. But we often see that you tend to forget doing these periodic access. And one of the other things is having these event-based approach in which when a person leaves, the first thing you should do is basically remove it. With systems like ours, where you have SSO integration, it's basically you can do that in a single place and will sort of mitigate through the systems. But if you don't have SSO access, it can be sort of a cumbersome process going through all these systems and removing people. 7 out of 8. I should remember we'll have time for some questions. You should review your system. I think the bad news is there's no solution out there that I've seen, at least, that will guarantee you compliance. You really do need to, as I said before, no matter how safe your car is, you still need to drive it responsibly. The good news, though, is that some systems will make compliance much easier, and they will support you in making this systems or making your processes compliant. But remember, systems can never be 21 CFR Part 11 compliant. I object to the idea that a system can be 21 CFR Part 11 compliant, because how the system does not operate itself. It does have to have configuration. It does need to have people involved. So in terms of training, first of all, it is a requirement from 21 CFR Part 11 that you do train on how to use these systems. So there's really no way to get around it. And it's really the only way to ensure that you're using a monitoring system, in this case, compliantly. And new procedures and processes do change, so do keep up with this. It's not something that we see a lot, but sometimes these misunderstandings can lead to violations of 21 CFR Part 11. And lastly, please do document all training. It's really, really a thing we see often is that people do the training, they're really well trained, but you don't have the documentation in place.
Yeah.
So for my last few slides here, a bit of tips and tricks, but what do we see often? First of all, make a compliance report. If 21 CFR Part 11 is something that is applicable to you, what we actually often tend to do, and what we've done as well, is just to make a short report. It's not the full validation package, but basically state out the different requirements of 21 CFR Part 11, and then state how you plan to use this system in compliance with those requirements. It is often a way to get everyone on the same page. How do we handle all these specific requirements? Also, because 21 CFR Part 11 is presented in bullets with specific section numbers, so it is really easy to make that A to B connection. Remember again, we have 21 CFR Part 11 regulatory requirements, and then we might have on top of that internal requirements. So basically, how do we apply these different system requirements? And that leads you to being able to fulfill these requirements. So some of the things we're often seeing that auditors are looking for, some of the easy ones to get past here, shared logins.
Basically the TLDR you could have shared in the beginning.
This is the cheat sheet. Shared
cheat
logins,
sheet, yeah.
don't do it. I think we've went over that in full detail. Secondly, no periodic access reviews, and it's really easy to go in and see whether any former employees, it's some of the first things they'll look for. Do former employees have access to these systems? Well, it's a big no-go. Audit trails that are disabled or never reviewed, how much should you review and so forth? It's up to you, but you need to have an audit trail review process in place. We often see as well, like just deploying system, it says that it's 21 CFR Part 11 compliant, so let's just use it. You still need to have your assessment of the system. Often you can reuse a lot of the vendor activities using in the vendor validation as part of it, but you still need to do your own assessment. And also temperature records that can be deleted or altered, especially if you have your data stored somewhere else in the system. Where do you keep your originals? What data do you present to an auditor on visit and so forth? And then missing or outdated subs. Yeah, I think we'll jump right to the questions.
I've lined them up here. We've had Lou Han's question for a while here. What records from a monitoring platform typically needs a signature and what not?
So if we're talking specifically thermal compliance monitoring platforms, one of the key things would be stuff like you're having your alarm limits set, whether you're acknowledging alarms, whether you're commenting on alarms or closing down alarms. So basically, if you're using, like in our system as an example, you can do deviation management directly in there, saying this alarm happened because X, Y, Z and so forth. Well, that's a record you're relying on in order to have an estimate of whether you need to do anything more, or it can sort of be an initial root case. It could be records like inviting or removing users from the system. You still want to be able to go back and say this user had access from this point in time to this point in time. So there's a ton of different records. But basically, as I think often ask yourself, like, if I wanted to assess whether this product was stored correctly, what would I look at? And everything that touches that path should basically be Part 11.
Then, Francis, I hope you're still there. I can see a pretty good attendance rate, by the way. Asked quite a while back, if we scanned all the paper records, could we get rid of those, the paper records, basically?
That's a really good question.
There's an even more complicated one, so we're still warming up.
We do see that storing for long-term paper records in an electronic format is accepted, but I have to be honest, it's not something that have a lot of experience with in what satisfies different requirements. We've seen it a lot of places where it satisfies auditors, but in my opinion, it's a bit of a gray zone. But I would say, regardless of all these regulations, you really need to think about how do I retrieve these systems? How do I ensure the integrity of these records? I mean, all of those things are still going to be asked. So let's say you scan your documents as PDF. How do you ensure that those PDFs are tamper-proof, both from a user access level kind of attack surface perspective, but also, can you digitally sign those records? Can you cryptographically protect those records so that you know they haven't been tampered? Those requirements don't disappear just because at some point in the lifetime of that record it was in paper. So that still applies.
Okay. Here comes a slightly longer question, and it might go back to something you said you were not expert in. So let's see. But it's from Christoph. I have a question that I'm trying to get clarity around. Under 21 CFR Part 11, for a closed SaaS, so software as a service system, used only by internal lab users, are cryptographic digital signatures on exported records required, or are standard electronic signatures with the system sufficient? I appreciate the thoughts on this.
So thank you, Christoph. So one of the items we didn't really have time to touch on today is basically that the 21 CFR Part 11 distinguishes between open and closed systems. So in very simple terms, if you have a system that you're only using yourself and you can verify the identity of each user in the system, you have a closed system. But if you have a system in which a wider audience of users are accessing, then you have an open system. I won't go into much detail with this. but it also has to do whether these records leave the system or not. So often we would see that electronic signatures are fine, but that digital signatures are required whenever you're trying to send that to the FDA or when you have other uses of those signatures.
And then we had an abbreviation.
Just to clarify again, think about it this way. If you're sending outside of your system a record that you're relying on staying complete and traceable, you would want that it would not be possible to alter that information.
Of course. So an abbreviation came up, Alcoa, that you actually haven't mentioned, that of course is associated to this, right? That would be, is it attributable? Is it legible? Is it contemporaneous? Is it original and accurate, Alcoa, right? And that linked, so the original record needs to be archived. But interestingly, Lone Jespersen brings up, if you want to PDF original paper records, so linking to the question from before, you have to do it in a certified way. Jakob, what is a certified way then?
Yes, so I would assume that the meaning behind writing certified way is basically the practical way of what I'm trying to say here. So basically, you need to ensure the integrity of the data, and that would be in a certified way. So I think it's important to understand the history, right? It was it in the, and correct me in the chat here, was it in the zeros that we would have these large issues with photocopied and PDF'd records in which the machines started to alter the data on the scanned elements. So basically, again, you want to ensure the integrity of that system, and there are specific systems that are made for scanning in documents from paper format to digital format because of that large scandal we had quite a few years ago, where the PDF scanners would actually alter the documents and would actually change numbers in the way that they try to memory optimize. But yes, certified way, validated way, whatever, you still need to satisfy the requirement. How can you justify that the digital records, even though they are scanned paper records, are still Alcoa applicable? And yes, Alcoa, and now Alcoa Plus, and now Alcoa Plus Plus principles still do apply. It's the exact same thing. The 21 CFR Part 11 just, I would say, specifies in greater detail how you should actually implement these principles. And yes, we could have implemented Alcoa Plus Plus principles in this presentation. Unfortunately, as you see, we're almost running out of time. But yeah, thank you.
A ton of questions to mappings. It's usually when we do mappings, we have questions to 21 CFR Part 11, and now it's vice versa. But upy.com/webinars, you can find something that will probably cover the questions you had in there. Jakob, let me end on one final question for you before we're probably out of time from Taha. This is a little bit associated to our platform here. On the change control topic mentioned earlier, Eupry recently upgraded to version 4.0. We did. Super nice. As per release note, all updates were validated before deployment. This is a software upgrade, of course. Should we do a change control for this?
So that's a great question as well. So specifically in Eupry, what we do is that we validate all systems, all software systems, hardware systems, whatever we release prior to release. And of course, that does not exempt you from doing an impact analysis on site. So what by far most of our customers do is that we send in advance a release note stating what is about to change. You do an assessment of whether you want to use those functions. It's not always something that's relevant, the criticality of those functions. And then do an impact assessment is what is it that we need to validate after the change has been released. And you can reach out to us and ask for validation documentation so you can see some of the activities that we undergo. So we use a ton of time on validating and testing thoroughly these systems, so you might as well use us. Thank you so much. There's a ton of great questions already. Thank you so much for helping each other in the chat.
Yeah,
that was really wonderful. We're just going to go to blank screen in just a short while, but I actually think as something we haven't done before, please leave a few comments. What should we do better? It's always really difficult to get an understanding of how well we did. Give us 1 to 5 stars. Give us a comment. What should we do? Or do you have any other topics for upcoming webinars?
And actually, I'll be back already on Tuesday. And instead of Jakob, I'll have Martin, our VP of product, and we'll talk into some of the latest product releases, but also a few upcoming ones from the roadmap. Yeah. So that might be interesting for some of you that targeted your questions into existing services.
Great. Thank you so much for joining in. And then please do leave a comment below. What should we do better? Or did we do a good job? Thank you very much.
Thank you, guys.
Bye.